Good afternoon, everyone. I'm Debbie Hart, the President and CEO of BioNJ, and I'd like to thank you for joining us for this really very timely program. Today, our panel of experts will share insights on the evolving landscape of AI-driven finance and explore the key trends, challenges, and opportunities that are driving financial innovation. A special shout out to our hardworking planning committee, our finance planning committee who brought this program forward. Brian Lenz and John Pennant are our wonderful co-chairs. So a special thank you to them and all the committee members. So thank you also to today's program sponsors, EY and PricewaterhouseCoopers. I'd like to recognize Michael Bay from PricewaterhouseCoopers and Joel Wagner from EY, whose contributions have been vital to developing our agenda, and they also just happen to be committee members. Today's webinar is being recorded and will be available tomorrow on bionj.org. So we have many in the room today and more even expected. So we will try to get to as many questions as possible at the end of the panel. We'd invite you to type your questions for our panelists in the Q&A box. And if we don't get to your question, we will follow up after the program. So let's get started. So to set the stage for today's discussion, I'd like to welcome Principal at PwC, Ronan Wisdom. Ronan, welcome, and the floor is yours.
Thank you, Debbie. Hello, everyone. I'm going to spend just a few minutes grounding us in what's happened over the past year. And I'll also touch upon some of generative AI's core strengths that are particularly relevant. Now, I think everyone on today's call will know that artificial intelligence is not new. It's been around since the 1950s, since the first papers on neural networks. And since then, we've gone through several evolutions, several periods where the reality did not quite live up to the promise, particularly in the 1980s and the 1990s, when we realized the constraints of the technology at the time. But for the last 10 years or so, a form of AI called machine learning has generated a lot of real world value. And we've also had language models for several years. All of the major players have been investing in them. But last year, a company called OpenAI quietly cracked the code on training their language model on the entirety of the internet. And really importantly, they gave us a way to interact with it called ChatGPT. And suddenly the barrier to that knowledge completely disappeared for anyone connected to the internet. Before that, really data scientists were the only people who could use these models, but OpenAI and others have changed that. And over the past 12 months, we've seen breakthroughs pretty much every couple of weeks across industries on how this type of AI can be used. So on that topic, how can it be used? Well, generative AI has several core strengths, but I'll mention four that are particularly relevant. Firstly, summarization. As humans, we do a lot of summarizations. We read, we interpret, we make judgments, and we summarize those out. Now, this is something that Gen AI is really good at. It can read a lot more than a human, a lot faster. It's already read the entirety of the internet. So the ability to summarize large bodies of information is one of Gen AI's core strengths. Secondly, augmentation. Not only the ability to summarize, but to augment, to assess a body of information, whether that's structured or unstructured data, numerics, text, imagery, but to assess it and enhance or augment that information in a number of ways. For example, by connecting other data and ideas, as we humans do through association, augmenting the original data with new insights, new analyses, and so on. The third core strength I wanted to note is the ability to create new content. Partially why we have the name generative is this form of AI can create new content. It can help us draft things, draft contracts, policies, work orders, and more based on all of the examples that the AI has been trained on, which, as humans, we can then review and finalize rather than spending our time searching through all of the potential examples for, to come up with that first draft. And then lastly, dialogue, taking all of these capabilities and then engaging in natural conversation with humans, either through chat interfaces or increasingly realistic avatars. And that enables us to ask questions in a very human way of all of the data that the AI has encountered. And this is changing how we think about interacting with information and how we can support our internal and external stakeholders, whether that's, employees, partners, healthcare professionals, and of course, patients. Now, all of these abilities translate really well to helping us in everyday tasks, whether we work in commercial or manufacturing or in R&D, and of course, in finance. I hope that's helpful as the panel discussion gets underway here and gets deeper into Gen AI's impact and promise. And I'll hand it back to you, Debbie.
Ronan, that was very helpful for me personally anyway. So thank you for that. Really a foundation for today's discussion. So next, I'd like to introduce our panel of experts, beginning with Partner of Data and Technology Transformation for IBM, Rashmi Gupta. Welcome, Rashmi. Director of Finance Transformation at PricewaterhouseCoopers, Michael Eiler, and welcome to you, Michael. Senior Vice President of Clinical Pharmacology and Analytics at Hepion Pharmaceuticals, Dr. Pat Mayo, and Partner for Finance for PwC, Matt Ritter, and as well as Principal at EY, Zeev Vir. So welcome to all of you, and we are going to jump right in. So Matt, starting with you. So we hear about the AI revolution. Is AI set to completely revolutionize the finance function in biotech, do you think? Or is it just another overhyped tool?
Thanks, Debbie. Can you hear me okay?
Yes, we can.
Perfect. I think it's a great question. And I think there's been some skepticism for sure. I think within finance, there have been a lot of enablers and value drivers that we've talked about in the past, or that we've gotten pretty excited about historically, like modern ERP, a lot of excitement around RPA, even blockchain for a while was promising to revolutionize the way that we think about things like third-party handshakes and transactions. I actually remember attending a blockchain conference a few years back before COVID, where people were super excited that blockchain was going to automate our gross to net process as it created trusted transactions between sellers, distributors, point of sale, and customer. And I think we can all agree we haven't seen that come through yet. But I think within finance, some of those enablers have under-delivered, right, or others haven't been able to keep pace with what's been a trend in finance, which is that we need to do more with less, or we need to do more with the same. As we make these investments within finance, there's an expectation that we are able to do it with less people, less resources, right? We're able to drive more value. And I reference all of this because I do think AI is different. For starters, we're seeing organizations both identify and solve for pretty impactful use cases already today. The velocity from an idea to where we can see it exercised in a pilot has been incredibly fast. We're also seeing vendors, big ones like SAP and Oracle, for example, work these capabilities into their product roadmaps. And lastly, as Ronan had referenced earlier, some of the interfaces that have been developed, like ChatGPT, offer a much faster path to user adoption. There's little training needed on the tool, right, versus more emphasis on understanding what you're trying to solve for, or what population of data that you're working with, what your constraints are. I think this technology is beyond promise, and while I don't think finance will necessarily be a first mover or first adopter, I do think it'll be disruptive. And I also think that while we say finance may not be a first mover adopter, the distance between what we define as a first adopter, but the time and distance versus the time and distance to when we'll see it adopted within finance specifically, is it's a very short gap, right? It's not going to be a long period from when we see it adopted broadly to when we see it within finance. So I think it's a great question, but I also think that this will be pretty impactful.
Great. Thank you, Matt. So Michael, building on that, how do you see the impact to the workforce? Will AI take away jobs? We keep hearing about that possibility, but will it take away jobs in the finance departments of biotech companies? And how should we anticipate finance roles are going to evolve and change, as I'm sure they will?
Yeah, great question, Debbie. Thanks for that. So So first of all, similar to what Matt said before, I also truly believe that AI and Gen AI will have a significant impact to the finance function. And whenever there are changes to the finance operating model, there are certain implications to the workforce as well. And I just came across last week, I've seen a great advertising that described, like in a very simple way, how AI can impact the workforce. So let me play that back to you. But it shows a picture of a finance professional. And it says in capital letters, AI is taking my job. And then it says in small letters below, to the next level. And this is how you can think about the implications to the workforce. AI capabilities mainly help to augment human capabilities. It's less about replacing human work. Matt spoke about like RPA before. So, and when you think about RPA was a tool that was built for automation, right? They were literally mimicking human work and then automating that same work. It's different for AI and Gen AI. They have more so, well, while they do have some applicability for automation, they are more importantly supporting a finance professional in their existing roles. In many cases, these tools can be understood as a co-pilot to the finance professionals. So let me give you some examples. On the operational side, I think it can drive operational efficiency. It can increase individual productivity. Examples could be, and we heard it from Ronan, as simple as drafting emails, writing audit memos, updating, maintaining policies, reviewing, summarizing contracts. And then when you think a bit on the flip side and think a bit about more strategic value-add activities, that's where AI and Gen AI provides additional capabilities as well. So for example, it can help financial analysts to get deeper insight. It can help controllers to better analyze balance sheets. It can be used for a finance business partner to help with business case development, idea generation, brainstorming, and many more activities. So these are some examples that illustrate how I expect finance roles to be impacted. I think what's critical as well is to think about how do you prepare for that. And I believe there are two avenues that you should start exploring. One of it is there is an upskilling opportunities, which is more at the individual finance professional level. A lot of the Gen AI tools and LLM tools, they are publicly available. So everyone is able to get smart about how to best use them at the individual level and for their distinct areas. I think the second part is more at a company-wide level. So there's a requirement that companies need to start defining what are the guardrails, what is the appropriate governance to make sure that these technologies are being used in an effective and safe way.
Thank you, Michael. Some good guidelines. And I just love the AI is taking my job, ... to the next level. That's terrific. We will use that. Okay, now to Ziv. So understanding, Ziv, that there will be an impact, as we just heard from Michael, to finance in the future workforce. How far has the market already evolved using AI and Gen AI? What are companies focused on right now?
Yeah, great question. So what we've seen up until now is that most companies are essentially kicking the tires or letting 1,000 flowers bloom, as I often think about it, which is you have small groups who are saying, hey, I heard about this, maybe it'll do something interesting for us. Let's do a little pilot here. Let's do a little pilot there. And I think we've seen that for maybe the last year or so, just as we've seen other experiments in AI in prior years. Where companies are getting to now is they have enough of these, and there's enough kind of in the news and media that a number of them are waking up and saying, all right, I've got a lot of these little things. How am I governing them? What's my risk? I'm hearing that the government's going to step in. I'm hearing some stories about how people did things that were inappropriate. And so now we're kind of getting into the, we're maturing this a little bit. And so now we want to put some controls in place and all that. And what we're starting to see, we're at the very, very early parts of, is that some of the leaders are the ones who are now starting to say, okay, I'm going to make a commitment. Some senior executive is going to bet a little bit of their career on that. And that means I'm going to go after a bigger, more audacious goal than a pilot. And I'm going to do a bunch of use cases in Gen AI at scale to achieve something. And those are the early adopters who are going to probably, on the one hand, kind of flame out royally if they're doing it wrong, but the ones that will be successful, the ones that will actually gain some strategic white space in whatever they're doing, big cost savings, things like that. And I would expect you're going to see some of that going back and forth for the next probably few years. And then eventually the technology will get mature and the barrier to entry will go down enough that we'll see a lot of other people come in and start taking advantage of this. But that's kind of where we are right now and where we're headed.
Okay, that's helpful. So meanwhile, let's take a step back. So how are Gen AI and AI fitting into the broader finance tool set? How do they complement other technologies and methodologies?
Yeah, so if I look from a finance perspective, there's kind of like 5 buckets that Gen AI, there seems to be a lot of experimentation around, and it depends on which group and all that. So there's the automation of certain activities that up until now has been very difficult to do. So for instance, if I'm in the billing department, automatic invoice generation, automatic processing of invoice generation with the ability to escalate to a human being, that really wasn't practical until the AI models had gotten sophisticated enough. So now people are putting that in. As well as even chatbots. If I've got a billing question, things like that, the chatbots are getting sophisticated enough. So we're seeing some automation there. We're seeing similar automation in kind of account operations, a lot of automated reconciliation of data. Does the data here match the data over there? Where do we have a problem or not? Financial services actually led a lot of this a few years ago, and now it's percolating and dripping down into the biotech players out there, and so on and so forth. On the other hand, where we're seeing is strategic insights and some of that stuff. So we're starting to see the use of large learning models to ask questions and deliver more automated, customized reporting. One of the biggest challenges we've had traditionally is all my BI reports answer every question except the one that the senior vice president of whatever is asking at this exact moment. And so there's a lot of work now on how do I use kind of these large language models and all that to generate reports where someone can ask a question and get results back. There's a lot of excitement around that, the ability to get much faster insights out of all the data we've got. And then the last area we're seeing is in procurement. Procurement, I actually think, is one of the biggest areas because even automated negotiation based on very common things or advice on how to negotiate or the summarization of offers and stuff like that, we're seeing quite a bit being done there as well. So that's kind of the biggest areas where we're seeing various players, and the tools and the standards are beginning to emerge. People are building custom solutions in the absence of those, but I expect in the next 12, maybe 18 months, you're going to see a lot of changes and a lot of maturity in those spaces.
Perfect. Thank you, Steve. And we're going to come back to you in a moment and ask you to look a little further out for us, so beyond just the next year. So thank you again. So Rashmi, I want to bring you in here. Really, it'll be very interesting to hear what IBM is seeing. So can you provide our participants with some real life cases where Gen AI and AI have made significant impacts in the finance functions of biotech companies?
Sure, Debbie. Thank you so much for inviting me to this webinar. Let's put the perspective onto the biotech industry itself, right? So biotech industry by 2030 is forecasted to be $3.8 billion. And the Gen AI itself would be used 30% for drug development. But as the drug development evolves, and the financial functions must also evolve and scale. But as we have seen in the biotech sector itself, we have seen that there are key business imperatives, right, to really reduce the cost and improve the productivity. And that's where we are seeing the strategic use of the AI for the biotech industry. And Michael did touch upon the few of the use cases, and this is where we are seeing, right? So taking from the POC level to actual adoption, there is still a gap, but we are seeing a couple of strategic initiatives within the biotech sector around revenue cycle management, right? So how they can do effectively the financial planning, the budgeting and forecasting in a more intelligent way. Clinical trial management itself, right? Not the actual authoring piece of it, but the planning and the analysis piece of it, right? Around the eligibility, verification, authoring. And that way they are trying to reduce their spend and expenses. I think another critical aspect in the biotech industry is finding the right talent, right? So that talent management and augmenting it with the knowledge workers, right? So where the higher value of the work, as we just talked about, right, is not able to replace taking the job, but taking the job to the next level. So where the mundane jobs are basically for the AI to do and increase the productivity, but my skilled labor is being used for actual biotech productive work, right? Last but not the least, where we see a big usage of the AI and Gen AI in conjunction with the automation is proactive regulatory intelligent reporting. This is basically to assemble, review, and collaborate for submission packages. This definitely reduces the time to respond. One of the things which we have been doing and looking at through the lens of the data itself, because from the preparedness perspective, the industry is not there yet. The data is like siloed, it's everywhere. They are trying to do the things just in time. So we are looking through the lens of the data also as we see the AI, right? Is the data right? Because one of the biggest concerns is around data privacy and security. So strategically, is my data an enabler for the AI or not? And if I'm taking the AI to the next level from the strategic perspective, what are the guardrails as we talked just before? What are the guardrails and what is the readiness from the data perspective? Is my data quality controlled? Are we getting the right results from that data? Do we have any bias? Those are the few things which we have seen in the industry, but those are the four major use cases: revenue cycle management, clinical trial management, talent management, and proactive regulatory intelligent reporting.
Great. Well, thank you, Rashmi. And, we're going to come back to you in a moment because trust is just so important in this whole new area. And we're going to talk about that in just a moment. Meanwhile, Michael, do you have any examples you'd like to share from the PwC perspective? What are you seeing?
Yeah, I think those were great examples that Rashmi mentioned. I think if I want to make a step back, and there's a broad AI toolkit that is applicable to finance, right? And the way we think about it is that each of these different tools bring distinct capabilities and they can unlock distinct use cases for finance, right? So let me give you maybe some examples of the tools and the use cases that I see in the market as of now. Smart data extraction tools. A lot of you might be working and using those tools. You can think of tools like Kofax Total Agility, Abby, IQBots, etc. They can help you capture and extract distinct data points from documents. So, for example, whenever you're working with external documents, this is where they come into play and can help you drive efficiency. So, for example, invoice processing, incoming payments, contract management, sales order processing, and many more. Steve mentioned before chatbots. All of us, of course, we have come across chatbots as part of customer service hotlines. Similar to that on the finance side, it could be applied. So, for example, I see it being used as part of like a smart help desk for AR, any AR inquiries, a smart help desk for any AP inquiries, etc. Machine learning, I think, Rashmi, you made a good point, right? And you said kind of like one of the big use cases in finance is revenue cycle management. And I see machine learning, when you think about machine learning, those are the tools that are using algorithms to identify specific trends and patterns in large data sets. And this is a great example that Rashmi mentioned, right? A very impactful use case is actually using that to have stronger, better, more accurate forecasting. When we come to Gen AI and generative AI, I mean, we all understand this is kind of like a cutting edge, kind of like the latest toolkit that came to the market. I would say there's a big variety of use cases, and it varies a lot by level of impact that they had on finance versus kind of like what is the level of effort it needs to implement those, right? And if you want to start small, and what I see some of my clients doing is with just smaller investments, for example, setting up a private instance of an LLM module, you have a great starting point. For example, at PwC, we have developed Chat PwC tool, which is ultimately based on GPT 3.5 from OpenAI, and it provides the benefits of increasing general productivity, right, across like all the employees. So that's a simple first stepping stone that you could take. We also use it, for example, for knowledge management. So GenAI can be a simple user interface to help you easily query any knowledge that you have in your company. When you think about a bit more complex solutions, so when you build upon just like the out-of-the-box capabilities of GenAI and LLM, when you start thinking of, for example, combining machine learning, GenAI, other tools, when you start thinking about like, hey, I want to connect those tools to my data warehouse, to my ERP, to my EPM, this is when you unlock additional and a bit more complex use cases. So what I see being very impactful, and that we have a lot of discussions with our clients, is using a combination of machine learning and GenAI for trending analysis and commentary generation. So you would have machine learning to identify anomalies in your accounts, FSLIs, and then use GenAI to turn it into a commentary. Or what Sif mentioned before, I think there was a great example as well, ad hoc analytics, right? Nobody wants to be waiting for like the monthly reporting that's coming. And even if you get your monthly reporting, there are always additional questions. So you can use GenAI and you can connect that to your data warehouse and democratize a bit the data and kind of like create the reports and analytics at the time you need those. So I could go on for a while, but I think those are some of the examples that I see in the market being successful.
That's great, Michael. Thank you. Lots of opportunities, lots of capabilities. And, we talked about that we're going to come back to you, Rashmi, with the really important question of trust, right? Can we truly trust AI with our financial data, especially in an industry like biopharma where it's so critical? So Rashmi, what are your thoughts on trust?
Sure. So as I'm a number person, right? I would start that 80% of organizations are adopting AI. But the recent survey done by IBM, they found that 34% of them are concerned about data privacy, 25% are facing the skill gaps, and 75% are having trust issues, right? So they are still articulating how to use AI with trust. Not only just the financial functions, but all the way around across the industries, right? So which is a very powerful number, that only 5% have some trust into the AI, and remaining 75% are still trying to get that trust level. It's about how we build the AI, right? So as I said before too, it's very strategic imperative in the business. Businesses are seeing the productivity gains, but at the same time, you have to build it right? You have to. So one of the offerings which IBM has is Center of Excellence for AI and Gen AI, which is basically starting fresh and how to build the trust to remove the bias and the hallucination, right? So one of the examples of the hallucination is basically I'm showing an image, but the image is popping up and giving the answer, different answer than what the image itself is. And the bias itself is around how you interpret the data and how it is skewed to one particular result, right? So, and you don't want to be in trouble, right? What the state of New York went through with the employment regulations around the hiring, right? Where the hiring itself was limited to a certain set of folks which had applied. So we want to make sure that the bias and hallucinations are eliminated. And to do that, IBM has created a framework, which is open and with the 4 core principles, right? So the basic one, the very first one is around the openness. We want to go ahead and not exclude any of the AIs, right? We have to get the best of the breed, even if it is an open source technology, right? The second one is trusted, right? And we have a framework on to create a transparent, responsible, and governed AI models through a proper feedback loop, making sure that the data itself is available, secure, and transparent so that they can understand and have that responsibility within the AI. Third one is around targeted, right? And I cannot stress more on this, right? Any Gen AI use case, if it is not driving the business bottom line, businesses are not ready to really fund it. So we have to make sure that these particular AI usage is around use case driven and for a business domain. And last but not the least, right, empowering. Businesses are very concerned about their data, about the prompts which they are using in these models, and they want the full control of that data and models. So those are the four core principles. If you adopt, that will give you some trust into the AI, and probably will see the survey numbers going a little bit better.
Great. Thank you, Rashmi. A little reassurance
Yeah.
there, and thank you for the data points. So Steve, we're going to come back to you as I promised. So looking to the future. So if AI is the future of finance and biotech, which it sounds like it is, what does that utopian future look like in 10 years?
Yeah, so the interesting thing is let's talk about, first of all, what we need to do to get there, because it's important to understand that part of this is just pacing ourselves. You know, when we had .com, when it originally busted into the open, and you had Amazon and all these other players, you had the retailers, all of them wanted to go online. And what they found is the way they managed their data, the way they had product information and all that, it wasn't ready to go online. And it took them quite a number of years till they got to the level of sophistication that could actually put things online and benefit from that. Their systems were old. This was not a place they invested in. I think we're going to find a similar kind of trend within our financial organizations. AI is heavily dependent on good data to be able to produce good results. Where we have good data, we will gain benefits. Where we have not so good data, it's going to take a little while longer as people get to maturity within these things. What I hope, however, is if we look 10 years out, we're going to see a lot of manual activities that we do today. I think what you're going to see is that the employees are going to age out and not necessarily be replaced by new ones. So if we have lots and lots of people doing bill reconciliation and all that, eventually those are jobs that we won't necessarily have within this organization. We're not going to lay off tons of people, but essentially we're not going to replace them as much because we're all going to get more comfortable with AI doing that, and we're going to place it with small number of editors. That's going to cover an enormous amount of manual work right now that prevents us from being able to do data-driven decision making. The other piece where we look, as we said, is the power of data is if I can all of a sudden interrogate my data and get answers much, much faster than I was able to before, I can truly be a data-driven organization. And while, you know, we all say today we want to be data-driven organizations, the reality is there's a lot of limitations around what a typical bio company can do in terms of being able to do that. So if you want me to summarize kind of at the end what I see the financial organization of the future, when these kind of changes eventually happen over a period of 10 years, is you're going to see an organization that is much more focused on providing strategic insights and decision making to the broader organization than working on day-to-day operational activities that need to be done just to keep the plane flying. And that is a very exciting place, I think, for many of us in finance to be going to.
So more of a strategy partner really in the organization. So that's great.
More strategy and thought, yeah.
Yeah, terrific. Thank you. So we're going to switch gears in a moment, but before we do, so one last question, and Rashmi and Matt, I'm going to come over to you. So for organizations looking to embark on the generative AI journey in finance, what are the key strategic considerations they should be aware of? And then conversely, what limitations and risks should they be cautious about? Rashmi?
Sure. So Debbie, I will answer the first part. As I said before, right? Gen AI is an opportunity to harness power of AI, right? It has gone viral. That's what I would say. In a year, the adoption has increased from 20% to 50% just in 1 year. It has taken by storm. But at the same time, we should not underestimate its complexity, right? It comes with, as I said, the trust issues, the skill issues, and even articulating around the data privacy and security, right? So let's not be an AI user, let's be an AI value creator, right? By aligning our business strategic and tactical goals. And I would say I love the 3-letter framework. So 3-letter framework is learn, launch, and lead, right? So learn is basically upskill your talent for the AI opportunities, right? So basically creating that talent pipeline for the Gen AI. The second one would be launching. So launching is, as I said, put it in a strategic perspective, create a center of excellence, right? That can create the data readiness for security and privacy. Make sure the models can be trusted and they are accurate by having the controls and the guardrails for being it to be transparent, responsible, and governed. And last but not the least, lead it, right? So lead it with the business use cases that can boost the bottom line, optimize the productivity, and reduce cost. Because the cost is the major concern for the biotechnologies, right? Because they want to fund their research and everything else. So that would be my remarks, right? Learn, launch, and lead. That should be the goal of the biotech industries, right? And be very focused on what are the expected results, right? Whether it is finance, whether it is clinical trials, or even the drug development, right? Just don't jump onto the bandwagon. Take cautious steps.
Terrific. Thank you. Thank you. Look before you leap. So Matt, over to you.
Yeah, no, I think I agree with all of that. It's a great way to frame it. And I'd say within finance specifically, the way that we're sort of seeing organizations sort of strategically organized around it is we're rushing sort of left on the use cases, right? So let's first, whether or not organization is driving something broader or not, right? Within finance, how do we think it can be used? What do we think the applicable use cases are? What do we think our expectations should be? And that can be very tactical, right? So the operational level, or I'd say from a strategic perspective, we're also seeing boards, right? Finance leadership teams think about what are some use cases and how that might be used externally, right? Or might even be used against us, right? As people can interrogate or query data that we may have external to the organization. Analysts have the ability now to also query and interrogate data. Granted, maybe external versus internal, right? But what are the ways that we should be thinking about the use of this, right? External to the organization as well. I think sort of the second piece within finance is understanding that we may or may not be in front of it in the broader enterprise within finance. How do we expect it to be delivered, right? So when we think about the strategy within finance, what are our vendors investing in? What exists on their roadmaps, right? The key strategic applications that we use within finance. What's our organization strategy, right? Are we building a factory around this? Are we creating private instances, right? Are we leveraging more public, right? Public or outside solutions, right? What's going to be inside our walls versus what's going to be outside our walls? And if we're taking more of a pilot-based approach, right? What are the solutions or the technologies might be leveraging for that? So, right. So we think about moving from use case to pilot, right, or delivery of this. What's sort of the strategy and how that'll ultimately be delivered? And then I think within our controllership function, specifically within finance, obviously a ton of questions around privacy of data, security of data, quality of data, the hallucinations, as Rashmi had mentioned earlier, right? And sort of how do we start thinking about framing control, right? Or leveraging AI or generative AI, right? To help with data quality checking and control, right? How do we start putting some of the guardrails, some of the constraints around how we might want to drive control? So I'd say those are probably the areas that I see specifically within finance. But all obviously needs to be connected back to the broader organization, the broader enterprise strategy as well.
Great. Thank you, Matt. Thank you. So we're going to shift gears just a little bit. We're going to hear from Dr. Pat DeMayo. So Pat, as we know, clinical development is really at the heart of our industry. And with this in mind, how do you see AI revolutionizing clinical trials?
Well, thanks, Debbie. That's a good question. One of the big things is it's a, in 2020 there was an estimate, it was about 1.38 billion dollars to get a drug on the market, right? And so that's a pretty good chunk of change. So one of the things that becomes an issue is, can you do that smarter? And for instance, can you do that better if you use more, if you have more information? So for instance, if you also add in things like genetics and transcriptomics, multiomics, we call it. But one of the big problems also with clinical trials is we often take these surrogate endpoints, and do those really translate into either quantity of life or quality of life? So is there a way that you can actually link to, say, real world data? And so one of the things that I see AI allowing us to do, and by AI, that's the generic term for machine learning, deep machine learning, and so forth. Not necessarily generative. Generative has advantages in certain questions, but maybe that's not the best thing, is to be able to pull all this information together in a more meaningful way so that you can actually decrease the number of patients you need to find your effect. Maybe you can move into the world of precision medicine. So maybe the one size doesn't fit all paradigm is not the best one anymore. So many companies are actually really embraced this. The other thing is, if we actually develop the molecule for a specific site, and we take those and those markers from the preclinical all the way to the clinical and out into the clinic, so the clinician can use them, then that also increases the efficacy, and also we can pinpoint the disease, so the right patient, the right dose, right, the right drug. And so then that has the potential to decrease your cost, increase the speed, and so forth. It is interesting that that 2020 estimate of 1.38 billion is down from 2.85 billion. So why is that? Well, there's a whole bunch of factors in that. But I do see that AI allows us just to pull this information together and we can do a lot more in silico before we actually have to start bringing patients in, running them through them, and I just need more and more and more patients to hit my endpoint, right? So I think that's one of the key things, that the way that we can actually pull that information together in a way that we never could before is how that's really going to help us develop more meaningful drugs that actually affect people's quality of life and quantity of life. And then that actually translates into, you can do it faster, you can do it with smaller sample sizes, and maybe you can even also maybe you don't need the big machinery to run, as many things as that. So that's just kind of the big overarching thing that I think AI can do. Yeah.
That's pretty exciting. So some good news. So can you maybe highlight a specific AI-driven breakthrough in clinical development that you find particularly exciting or promising?
Yeah, I think, and I kind of alluded to it, that old paradigm that one size fits all, right? And even when I started out, I was just doing a clinical pharmacology. It's like I have a 40 kilogram, 4 foot something young woman, and then I have a 6'8", 250 pound whatever. It's like, do they get the same dose, right? So this one size fits all, we know that it's not true. So the one thing that you've heard a lot about is precision medicine. So precision medicine is that right drug for the right dose for the right patient. And that's also based on your genetics, your genomics. So you can go do 23andMe and they'll find out that, oh, look at this, you don't metabolize this drug the same as everybody else. Or you have this marker that may say that you're going to react differently to that drug. And I think that AI has really helped us to bring that to bear, because before it was post hoc marketing studies. There's a drug, for instance, it's an antibiotic that some people have a mutation in a gene that if you get that drug, you're going to go deaf. Now, we used to find that out after the fact, right? It's like that was an old cartoon. How do I know you're allergic to these if you don't tell me before I give it to you? So the thing about that is that opens up the possibility that we can take a cheek swab or maybe a blood test or a hair sample and say, hey, this is the medication for you. These are not the medications for you. And the other thing is, what about specific diseases? Like, for instance, there was a big study they went through and they did the whole genome of the patient. By the way, that used to be thousands and thousands of dollars and take weeks. Now you can get your genome done over a weekend for under $1,000. So, but they actually identified a lot of genetic-based diseases that way. So I think that AI in particular has really helped the whole precision medicine thing. Now, the other thing is, it's not enough just to have a drug that you think works pretty well, it has a good risk benefit, and you might get it approved. The question is, what third party payer is also going to pay for that drug? If you've ever gone and got your prescription filled, you know, it only pays this much, right? So now we have some of these treatments that are niche drugs. They're large molecules, they're antibodies, they're all kinds of stuff. The manufacturing costs are very expensive. Also, we've got genetic therapy, which honestly can cost, there's one genetic therapy costs millions of dollars. But then if it cures the disease, one dose, and then it's cured, and then you also take that completely out of the population now, that actually saves society money as well. So I think that being able to actually screen for these with a simple test, have an AI machine learning algorithm that actually helps you identify that and get you to that point is something that I think is really very exciting. I think actually a lot of this machine learning AI has allowed us to move into precision medicine in a very, really more effective way. Yeah.
Right. Okay, that's promising, as I said. So meanwhile, on the flip side, are there areas of clinical development where the application of AI might be premature, or where we really need to exercise some caution before diving in head first?
Well, I think several people have talked about this, and they've talked about trust issues. I think the biggest thing about AI machine learning, large data sets, where I have your genetics, I have your proteomics, I have this whole profile of you, is your right to privacy. So the question is, who has that data? So if you this has been known for a long time, I've been at this for a while. If I want to take genetic information, then rightfully so, there has to be some checks and balances on that. The other thing is, even if I'm training an AI and I have, all this information, I could, especially if there was a data breach, someone could figure out who that person is, right? So then you have to do an awful lot more to ensure the privacy of the individual. And also, what people don't realize is you can now calculate things. Now, Jim Watson, everybody, if you probably, this is a test to see how many scientists there are in the group. Who is Jim Watson? He was the one that, along with some other people's data and other scientists, came up with the structure of DNA. Now, as he got older then, and we were sequencing, it just came out in several scientific journals. He agreed to have his genome published. But then he said, hey, except for this area around these things that encode for these certain tau proteins, because those are predictive of late onset dementia. Fast forward, he actually sadly developed late onset dementia, but he didn't want that shown because he didn't want people to know that. However, those of us who work in bioinformatics knew, well, you can impute with about 99% certainty what's probably happening with those tau proteins from the area around it. So the thing is once you've got this into a massive data set, and then data security becomes paramount, and the patient's right to privacy is, people can then learn things about you, and you can do it by putting things together, because in a clinical trial, we have all your clinical data, we have all your vitals, we have labs, and then if we add in this multi-omic, you can actually learn an awful lot about the patient. For instance, you could then go in and impute, you're in a study, let's say it's a study for seasonal allergy, but for some reason you actually had genetic information. You could say, oh, this person is going to develop Huntington's chorea, right? It's like, so how do you deal with that up front? So I think that's an area where, well, and increasingly there is. I mean, we're on the clinical side, we are highly regulated. So for instance, you're talking about data trust, we actually have to show, and we have to show the FDA, we have to hold the European Medicines Agency that our predictions hold true. So you have to do the whole thing about sensitivity, specificity, and so forth. So we actually have to demonstrate that. We also have to prove that the model that we're putting forward is the best model. So it's not like we can just dive in, use one thing and say, hey, this one worked great. So you actually have to show all that information. I do want to mention that the FDA actually in the clinical pharmacology division, they actually trained a bunch of their people in machine learning now, because they're ready to accept this type of information, to the point where you can actually also use synthetic patients. So you can actually create synthetic patients, but then you can actually completely run in silico potential trials before you'd actually even bring somebody in. So I mean, those are things. So regulation is necessary. Yeah.
Okay, lots for the regulators to think about here.
Let me add one more thing on that, because it's a very important question. I'm sure a lot of people are worried about is like, are there things we shouldn't be doing, and how do we know that now
Mhm.
before the horse is out of the barn. And here's the sad truth. Many of the things that we might be doing right now, regulations and all that will catch up as many as 10 years from now.
Yes.
And so there are things we're doing right now out of ignorance that we may be held accountable in the future. And so when it comes to how you approach a very difficult governance problem like that, we do have an approach and we have a way of thinking about it. If I were to summarize it all down to its bottom necessity, is if you have the right governance in mind and someone comes with a new application, you really have to ask yourself kind of the red face test. If tomorrow someone came to us and they said, you did this with your data, even if it's not illegal, how would we feel about ourselves if that came to light? And if the answer is we wouldn't feel very proud of it, you probably want to avoid it, because even if it's legal now, 5 to 10 years from now, it may not. This is just too new an area for the legal, regulatory, and quite frankly, public opinion to have gelled in a way that we can be comfortable.
Yeah, you raise a really good point. And I'm also a clinical ethicist, right? And I've sat on many ethics and IRBs. The thing we always do this, is it nice to know or is it a need to know? So for instance, you need to explain, why am I measuring all this? And do I need to put some constraints on that? I mean, we saw that Jim Watson said, I don't want anything around these tau proteins, but we also have to be aware of the fact that we can impute things, and we now have the ability to calculate things because of this massive amount of information that we have. So for instance, we have to put some very strict things in place around genetic information. We also have to say, well, are we going to go looking for these other things, or are we going to constrain our search to specific things that are related to, say, a biomarker signature for this drug or this disease? But I think you're absolutely right. That's one thing that ethicists and laws are kind of struggling with, and they do tend to lag, because as we learn that we can do more and more. And remember now, some of the costs we can actually, with good models, some models are acceptable to the FDA in lieu of some studies, right? So that's something that's developed as well. So I think you're absolutely right. As the ethicist in me would always say, take less information, right? And then the scientist in me says, but I want to know. But it's like, but are you really just fishing? And that's the other thing too, is whenever we write a protocol, it's like, are we just casting a big net and seeing if thinking that we may get something, or are we specifically looking for these things? And you really do need to point out to the regulatory agency, but also to the patients that you're asking to consent to be in this study. This is what we're looking for. This is how we will handle your information. And again, it's people's information. It is their information, so they do have a right to it. So we also have to explain, we're not going to go looking for genetic diseases, or if we are, then we have to inform, right? So then we have a responsibility to inform. So that all has to be set in motion ahead of time, and it all has to go into the consent form that goes to the patient. But you're right, Sid. There's things that we may not have quite thought of yet. And that's why, I don't know if you know, like from Google, they had one of their head AI people who's actually Canadian. He's afraid, AI is going to take over the world. And I don't know if that's really true. I think we lack the computing power, for one thing. Although some computers are pretty good coders, but then the kind of computer really recode itself. I don't know. Anyhow, I saw you unmute. I'll let you.
Yeah, I would just add one more thing to it. I mean, many people said, hey, ChatGPT broke new grounds and all that. And the reality is, if you follow this space very well, there were a number of AI engineers at Google, Facebook, and at Microsoft who had similar models before them and were worried about the potential for those models to be abused.
Yeah.
Think about fake information, fake news, all of these other things that could have happened. And chose to hold on to that until the technology was more mature. And OpenAI decided not to do that. And so they got the prize a little bit. So there's definitely kind of risks in this area we just need to be aware of,
right,
some of these things. Now, I'm not expecting, Skynet to launch the nuclear missiles tomorrow or anything like that. But there's certainly misuses of that technology we should be aware of, and that I'm much more worried about than our AI overmasters, taking over.
Yeah. Yeah, as a matter of fact, you remember Tay, thinking about you, the Microsoft AI, and then everybody went on to what was called Twitter in those days, and people bombarded it with all kinds of horrible information. And within 16 hours, it had to be taken down because it sounded like your crazy uncle at the Thanksgiving table and said horrible things and stuff. And everyone said, "Oh, this is bad about the AI." I felt sorry for the poor little AI. It had just gotten started. It wasn't very old or anything, and people gave it all this bad information, and that's what it learned from. Yeah. So you can tell I'm a father by that. This is my most prized role in my life, right? So I felt sorry for the AI, I have to say. So.
Thank you, Pat. Thank you, Z, for that great discussion. So, we heard from Michael earlier, the AI is taking my job, ... to the next level. I wonder, Pat, last question for you before we go to audience questions, and there are quite a few. If anyone has one, please feel free to put it in the Q&A box. If we don't get to it today, we will get back to you. But meanwhile, are clinical scientists, that lucky? Will AI, ML take jobs from current clinical scientists?
So personally, I'm going to key off of, I think it's going to take it to the next level. I think this is a tool like any tool we've used. I think there's one thing that I used to do a lot of, which was called population pharmacokinetics. And then you go through all these, what we call covariates, to try to figure out a better way to dose. And it might be body size, it might be genetics, it might be all these things. And it was painstaking, and you'd run and run and run and run. And my wife would say, the computer's making so much noise, could you move it somewhere? Things like that. Now AI can actually take over a lot of that function. So it can go through these hundreds of covariates, now thousands of covariates, actually 1.5 million discrete data points now per patient. And I can say, hey, I'm going to go for a coffee. I'm going to go on a motorcycle ride, and tell me when you get close, right? And then we can come back and let it do that. I think some people are concerned that, like, if you're a coder, it will take your job as a coder. No, I think coders will learn to use it as a tool. ChatGTP actually writes some pretty good Python code if you know how to ask it that and things like that. So I do really believe that, like all these things, this is a tool that really does help us. We have all this potential to improve how we develop drugs for people, to individualize it. And I think that it's going to be welcomed by most scientists because they'll realize the potential of it. We had one scientist, colleague of mine, Dr. Carolyn Zhao, and I presented this at a Canadian forum, and we had one scientist get so mad the whole discussion, we had to calm her down that the computer wasn't coming for her job. But I also think there's still that interpretive function, but you really can train the AI, if it, again, how you've trained it, the information you've given it can actually answer a lot of key questions for you. Some of it will become, how do you ask the question? It's the old Hitchhiker's Guide to the Galaxy. The answer to everything was 42, but what was the question, right? And good science always still revolves around asking the best question, not the most complicated, not the most convoluted, but the best question. And I still think that some people are pretty good at that. I think the AI, though, can actually parse through all kinds of information to give you a certain amount of clarity that maybe you didn't have before. So I think it's going to augment our jobs. Yeah.
Great. Thank you for that. And so now we're going to move to audience questions. And again, we have a few here. So I think this question is for you, Rashmi. So how do you maintain generative AI and securing data when moving from ML anomalies to generative AI insights?
A great question, right? So anytime we talk about the data security, I would also hint upon the data privacy, right? So you have to have the right rules in your data to define what is privacy for you. So is it your social security numbers? If you're talking about patients, is it beyond that, right? So, and then a possibility where the data aggregation can lead to the identification of the person, right? I used to work for CDC, and CDC had a mandate, right? If the zip code is say 30022, and then the number of people are less than 500, it's very easy to identify the folks by having their genres, by having their ethnical identity, right? So you have to have the proper rules to create those privacy and secure policies within the data itself. Secondly, I want to cite an example, right? Like about the data privacy itself, right? What is right and what is not right? This is around data. The second aspect which I'm trying to tell you about is the model itself. The model has to have the controls. I don't know if anybody read or this was a public news within Atlanta. A guy was arrested and was in the jail because he had committed a larceny in Alabama. There's a book by Chris Kashmir Hill. It's called Your Face Belongs to Us. And basically, the cops were using AI software for the facial recognition. And when you do that, his face matched with the person who had did the larceny and on the video cameras. And this guy was arrested from Atlanta, although the larceny was happened in Alabama. And he was behind the bars for 7 days for no fault of his, right? So I'm trying to tell you the implications of not having a secure policies within your model. Although the model is right, there is full trust issue around the model, but to what level you want to take your model to be. So those are the two major things which I would want as we use these models and the data for taking from anomalies to the Gen AI, because Gen AI understands, Gen AI puts a perspective and the context, and it learns by itself, right? So it's very easy to take what was there in the ML models, initial ML models, which were very much closed loop, to a next generation AI, where now they can learn and put their own interpretation on top of it. So proper testing is extremely important, making sure you have the right policies around the data privacy and security, and your models are tightly governed.
Okay, great, thank you. Another question. So I think this is for Michael. And anyone else is more than welcome to jump in. Can you suggest an AI tool that can compare 2 quarters of a P&L, calculate the differences per line, and then analyze the data to identify the drivers of the differences?
Got it. Thanks, Debbie. Yeah, I think that's a great question, right? And there's not necessarily an out-of-the-box tool that kind of like brings that capability that you can use and go ahead. There's at the moment, there's a combination of tools that come into play, right? It's a combination of, you need, first of all, machine learning capabilities. So you can think of, for example, Python has those capabilities, AWS has certain capabilities, and many others. That allows you purely to kind of like understand, like, hey, if I'm looking at revenue and if I'm looking at a swing month over month, quarter over quarter, what are kind of like the anomalies, what are the underlying drivers? So it looks into kind of like sub ledgers. It can look into kind of like account transaction and identify kind of like what is not as expected in the nature of that account I'm looking at, right? So this is more kind of like the machine learning capability and the tools that you need for that, right? Those are the ones. And then when you think about kind of like, I mean, you have that output, and Rashmi, you started explaining that a bit, right? When you have that output and you know kind of like, hey, here are the 5, 6, 7, 8, then Gen AI can be used. And for Gen AI, you have the 3, well, maybe biggest tools at the moment. It will be LLM tools like BART by Google, Bing Chat by Microsoft, GPT by OpenAI. They all have the Gen AI capabilities in the backend that you can use to then take those anomalies and kind of like, perform an interpretation, put that into a broader context, and then generate the commentary, right? And this is ultimately a combination of tools that help you solve for that use case.
I would add on top of that, just very quickly, the technology is not there yet that you can do it without a data scientist and a data engineer trying to adapt a general solution to your specific problems. And if it was there, data scientists wouldn't be making $200K and be some of the hardest people to hire out there in the industry. So I'll give you an example, a very simple one, right? I mean, if I'm looking at the difference quarter over quarter, if I'm a retailer, I might see a big difference between my summer quarter and my winter quarter in terms of the clothes I sell. But that's okay, because in winter we don't buy t-shirts as much, and in summer we don't buy big sweaters. There's nothing wrong with that, right? But an AI model without the right adaptation, customization, manipulation to the data, someone thinking through those things, it's not a magic box where you can just throw in all your data and it produces instant insights. The technology just isn't there. And so what we've seen in the past be more effective is you build semi-custom solutions around very specific problems in very specific industries to be able to identify that. And then you basically ask the question, is this problem worth solving enough that I want to invest a little time and effort in building the right model for this? And it can often be, but that's the way to think about it.
Great.
I think it's a great point, Saif, and I want to emphasize that, right? And I mentioned it a bit earlier, right? I mean, you shouldn't be thinking of it as kind of like an automation tool, right? It's more kind of like a co-pilot. It helps you get there like 75%. So for example, in the use case we just discussed, right? You'll have an output of kind of like a commentary that explains why you have a shift in a certain account, but you still need the expert. You still need the financial analysts, you need the controller who can make sense of that, who can make a reasonable check and say like, yeah, this makes sense, or here's kind of like a seasonality that comes into play that I need to feed back to the machine.
Thank you. So Rashmi, I think there's a question here, I think may have been directed at you when you answered a previous question, but do you have to mask the machine learning data then?
So again, as I said, it is dictated by the policies, right? Like what data you want to mask and how you want to mask. Because if you do the static masking, you will lose the insights because then you cannot aggregate and analyze the data. So you have to do the dynamic masking, and you don't have to mask the entire data. You have to mask only the fields which you think need to be secure.
All right, great. Thank you. And so there was an earlier question that came in about what other Gen AI tools are publicly available beyond ChatGPT. I think maybe Pat, that's a question for you, but please, anyone can jump in.
I just added a few that are kind of available, like GPT-4, Alpha Code, and there's on GitHub, there's Copilot, Bard. I think Cohere Generate, and I'm sure people around also know these. I think that might be a chat one, but there's kind of more and more there's those sorts of tools available. Ziv, I think maybe you had something to add.
I would tell you there are literally thousands of tools available right now, because what's happening is we made the technological leap with these transformer-based large learning models, which is kind of the big step forward from the previous AI models that drove things like ChatGPT. And now what we've got is a whole bunch of people saying, oh, now that we can do this, there's a use case over here and a use case over there and a use case over there. I last night was searching for image generation tools, music generation tools, narrative generation tools like a speaker and stuff like that, just on the App Store. I'm talking iPads. I'm not even talking about big cloud-based solutions on them. That there are literally hundreds and hundreds of tools that do that as people are exploding that space. So if anything, there's a lot of churn right now, and hopefully the application space will develop, but hopefully the number of solutions will start to collapse after a few years as people wring themselves out. But anything where it comes to content creation, media creation, things like that, you're just seeing an enormous amount of stuff out there. And some of it is like very, very good. And then some of it is actually quite funny in what they can't get right, you know.
It's also really quite amazing what you can just do in R and Python, you know. So I mean, the first neural net that I ever generated, it was just a back propagated neural net, and we had this little program called Brain Maker, and a grad student and we spent 300 of our hard-earned dollars, and you couldn't even open up the net to see the weightings, right? And now it's like, oh, I can do that in R for free. That's easy, you know. And I can do Bayesian causal models, and I can do, you know, it's just like, it's really quite amazing. I would say anybody who even wants to have a better understanding of it, just take a Python course and you can learn a lot really fast. Yeah, so
That's helpful, Pat. So we literally have 2 minutes left. I'm going to ask all of you, and there are 6 of you, because Ronan, I'm going to start with you. What is your best advice in 20 seconds or less? Ronan.
My best advice is to explore this space and do it thoughtfully and carefully. Don't let media hype, don't let anybody deter you from exploring the possible impact this can have, but do it thoughtfully and carefully.
Great, thank you. Ziv.
I think this is a very exciting time right now. I think we need to be able to be ready to experiment and try new things and understand that. But what we've seen it and again with other technologies as well is the best way to get to real business impacts. Real business impacts is to be able to do these at scale with a goal in mind. I want to cut, X% of the manual tasks within the FP&A organization. There's a dozen use cases. I need to be able to do a dozen use cases, not one after a year. And so for those who are very incented in let's bring some real business benefit, it's about scale more than it is about one or two.
Great, thank you. Matt.
I agree with both. I just kind of want to emphasize a little bit on the thoughtfully and carefully comments. I mean, I agree with what Ronan said. And on that, the only thing I would add is, just be aware as you're experimenting here. Some of the tools that were referenced, like ChatGPT or Google, Microsoft products, those are external, right? To the extent that you send data to those, it sits there, it's discoverable. So maybe not a direct answer to the question, but I just wanted to highlight that given the broad audience, right? Like just sort of be aware as you investigate, that definitely be thoughtful and cautious.
Thank you, Matt. Michael.
Yeah, to be honest, I can echo what Matt just said. I think, as a company, you need to start considering now how you deal with this topic, right? If you want it or not, your employees start using it. So you need to think about kind of like, what are the guardrails? What is the governance I need to put forward?
Thank you. And Rashmi?
As with the innovative mindset, I would say I see a North Star, but as we discussed before, Debbie, right? Look before you leave. Let's not be an AI user. Let's not depend on others' model. If you bring those models, make sure you customize for your use cases. You're able to scale, as they've said, and then finally put a perspective on it in terms of the trust and privacy. We don't want to be in the national news, right? So make sure you follow it with the guardrails and optimize it. I think that increasing the business bottom line had always been critical, whether it is biotech industry or beyond that. So yes, let's be a value creator.
Thank you, Rashmi. And Pat, we're going to give you the final word before we say goodbye.
I'd say watch for bias. An algorithm, it doesn't magically, someone said that, just solve your problem. So, the algorithm can be quite biased. It depends on how it was trained and things like that. So test for that. Be critical, don't just take the output and say, oh, well, it came from ChatGPT, it must be good. Just be critical, think about it, and always watch for bias. Yeah.
So we have a scoring algorithm, Debbie, right? Within IBM, we score the models based on 5 different parameters, as I talked before: the fairness, the bias, and there are other things. I know we're running out of time, but those will be good things to watch for.
Thank you. So we got a thank you from an audience member, and we'll close on that. So we are out of time. If we didn't get to your question, we will circle back after the program. A reminder, BioNJ.org for the recording of this session. Thank you so much, Dr. Mayo, Matt, Michael, Rashmi, and Ziv. We sincerely appreciate your time and your insights. And thank you to our sponsors, EY and PricewaterhouseCoopers. If you're not a BioNJ member, please join. We need you. It's how we do what we do here. And BioNJ events, look for future ones at BioNJ.org. So thank you again, everyone, and have fun with your adventure. And apparently they're not going to take our jobs. So this is good news. Have a great day.